Hello, today we're going to be showing you how to perform leech therapy. Next to me, I have all the supplies you're going to need to perform leech therapy. First thing you're going to need is a set of gloves for putting the leeches on the patient, and the second set is for changing the dressing. What you will need next is a set of alcohol pads to clean and sterilize the area before you put the leeches on the patient. Next, I have a container with the correct documentation for the leeches for this patient today. Today our patient is Chakani. He's been receiving leech therapy for a few days now, so these are his leeches. Before we perform leech therapy, we need to make sure to take the vitals of the patient and make sure that their hemoglobin and hematocrit levels are also acceptable for this. In order to put the leeches on the patient, we will need a pre-cut strip of gauze in which to corral the leeches so they don't start migrating to other places. And then after performing leech therapy, we're going to need to dress the wound. So I have some gauze here, I have some tape, and I have some pre-wrap. What you can also use is a hydrocolloid. And then at the end of leech therapy, you're going to need to store your leeches, or if you wish to dispose of them, you're going to put them in a container with 70% alcohol, and then dispose of it in the hazardous waste material bin.
Today, Het presents with a venous insufficiency ulcer with a skin flap. Sarah, Het's therapist, has placed her gloves on, checked his vital signs and lab values, and is about to assess the area.
All right, your skin flap looks like it's healing well, but I think we still need to promote some more blood flow. Okay. So I think we're going to continue with the leech therapy. How do you feel about that?
Okay.
Okay, all right. And then have you been experiencing anything else out of the ordinary today?
No.
Okay, all right. We're going to continue with that then.
Okay. Sarah is about to cleanse the area.
All right, so I'm just going to clean off the area. This is going to be a little cold, okay?
Okay.
All right, and since you're already bleeding down here, I'm not going to have to stimulate bleeding. All right, so we can just go ahead and put the leeches on.
Okay.
All right.
First step is to get a gauze with a 1 centimeter hole cut in the center. This is for the leeches to choose the desired area of where to bite. Next, Sarah will grab the leech with a non-toothed forceps and gently place it on Het's skin flap. It is important not to squeeze the leeches, for this can regurgitate them or injure them.
All right, so I've placed the leeches on you. Let me know if anything happens, if you start feeling anything out of the ordinary, okay?
Okay.
All right.
It is important for Sarah to monitor the leeches and the patient in order to prevent leech migration. After 30 to 45 minutes, the leeches will detach when they're full. Sarah will now grab the leeches with the forceps and place them in the 70% alcohol. She will now tightly close the lid and throw them in biohazard. Now, for dressing, Sarah is going to discard all the scraps, assess the area, check if everything looks okay.
Okay, it looks like leech therapy went pretty well today. I noticed that you haven't formed any clots, so that's good. We want to keep the blood flowing for the next few hours. All right?
Okay.
Okay, so now I'm going to dress your wound.
All right. Sarah's now going to grab a 4x4 gauze and place it on the area loosely to help initiate bleeding. It is important to monitor the site for bleeding every 1 to 2 hours. The major therapeutic effects occur after the bite. Sarah will now grab the scissors and cut the rest of the wrap.
Okay, so we're going to be monitoring this wound for the
Okay.
next few days. Okay, to make sure it's healing correctly. And I'm going to place this label on your dressing so that we know when we changed it.
Okay.
Okay?
And that's how we do leech therapy.
These are pretty good for leeches.
Yeah.